Does anyone have any final comments or just anything, advice that they'd like to share? Just anything that they haven't shared so far?
I have a thought. I think one of the cool things that I wanted to point out about this program that I has been really kind of fun for me in the last year is our interactions with the other residency programs within the Alliance. Obviously, in OBGYN, we get to interact with a lot of different specialties because women get pregnant all the time. But it's been, we have people who rotate on our rotation. We rotate with surgery, general surgery, emergency medicine, specifically rotates with us. Family medicine does as well. We're constantly interacting with our internal medicine colleagues. And I think that is, it creates an interprofessionalism that I think is really, really important to follow within your future career. Obviously, being able to interact with your colleagues and be able to kind of pull advice from different people is really important. And I think that the relationship between residencies is really impactful and has been very impactful for me in this program.
Does anyone want to add anything to that?
Yeah, so in radiology, we interact with every single specialty. So I can definitely kind of add on to what Tess said. It's really easy to kind of get your blinders on when you pick a specialty or even a program of, this is my job, this is what I need to do, and there's really nothing else. I don't need to know anything about any other specialties. It's kind of easy to get into that rut, but you work more with other specialties than I think you might anticipate, especially in radiology and a lot of these kind of ancillary consult type surfaces rather. So it's really important to you keep perspective of what your colleagues are doing throughout the day, what their needs are, and how you can best serve them and their patients, especially as a radiologist. And also when you're picking a program or even specialty, make a list of what's important to you, because everyone will have tons of advice for you. Everyone will say, you should do it this way, you should do it that way, you should do this program, or you should stay away from this program. But making sure you know what's important to you, because that is unique to you. Other people need other things, like it might be a location or a family proximity, or it might be the style of program. But just make sure you know what your priorities are, and that will help you narrow down your choice when it comes to choosing the right program for you.
I think that's really great advice. Sharjeel or Marco?
As Stephanie and Tess were mentioning, you are interacting quite a bit with some of the other specialties in the hospital. And obviously, that's not going to be one of the top things that's going to draw you to a program. But I think it's definitely interesting and important to when you actually tour the facility and you see how happy the general staff looks, including the other specialties. And I mean, obviously, it's not going to be the primary driving factor, but it should definitely play into your decision as to if you want to choose a program or not, because you are going to constantly have to deal with the other specialties, especially as an internal medicine resident. I have to consult all kinds of specialty, whether it's surgery, whether I'm talking to radiology about a specific read, or we're talking to someone from OB about a patient that's pregnant. We all want to have good interactions, and I think that the people you work with make that very important. So.
Yeah, as Sharjeel say, as an internal medicine, we work with multiple specialties, especially radiology. We call almost every day to try to find the diagnosis of our patients. But not only with other specialty, we work with the technicians, we work with our nurses. And actually, I think the St. Joseph Hospital have a really good environment to work. And it's something that you need to consider when you apply for a program.
And it's fun to have friends in other specialties too. That way you can call them up and when you're in a bind and please help me, like, what am I doing? And I think it's a great environment here to be able to have those friendships and that interprofessionalism, but also just to have friends as well. It's a great opportunity to be able to make friends in other specialties. So.
Well, I think all the information that all of you have shared has been invaluable. I've definitely learned a lot. So I hope that anyone watching this learns a lot as well. Thanks so much for being here.
Thank you.
Thank you.
Well, that wraps up our conversation with our residents, Stephanie, Sharjeel, Tess, and Marco. I hope this gives you some insight and clarity on the partnership between Creighton University, Arizona Health Education Alliance, and Dignity Health St. Joseph Hospital and Medical Center, and the opportunity for residency here. I'm Rachel Martin. Thanks for joining us.